Good morning. I want to welcome you once again to this community update. We have done this for a year now, in fact, more than a year. And the purpose is, as I've mentioned a number of times, is to try to keep the community up to date where we are in dealing with coronavirus and now where we are in testing and in vaccinations. And so today, you will hear from several of us. This will not be long. You'll hear from Chief Maloney of the fire department, and then you'll hear from Corey Edmondson from Peterson Health. And then I'll do a brief summary, and that'll conclude our report for today. But at this time, let's go to Chief Maloney to look at some of the stats related to this.
Thank you, Mr. Mayor. Citizens, I'll give you a brief update regarding the statistics that we've seen over the last month. Okay, so what we've seen and really kind of tracking this, hard to believe it's been a year now, but since February 25th, you can see we started out there and wrapping up the month at 99, right at 100. And then you can see that deceleration coming down to now. We were at 42 yesterday. Remember, this is a high of 500 active cases that we had in mid-January. So we're definitely starting to see that trend there. But I'm cautiously optimistic about this. And that's one of the things I think I want to make sure I'm clear when we talk about the statistics here, as we do see that deceleration or that trend go down. The average that we had in January was 357 active cases, with 17 hospitalized on average. February was 183 active cases with 9 hospitalized. In March, a average, we're not finished, but is 50 active cases with 3 hospitalized. As always, the hospitalizations we're monitoring that closely and working closely with Peterson Regional, and Mr. Edmondson will give some more information in regards to that. So you can see in the trend in March, we did have some zeros. That is very good news, but also can see the trend a little bit moving back towards 6. So we're continuing to monitor that. Next slide. So as we move into the grass, the trees, everything else blooming. So remember, it is still a continued public health threat. So nothing has changed in regards to COVID. Fewer active cases, but being cautiously optimistic and making sure that you're aware as individuals out there, the difference between seasonal allergies and the difference between COVID-19. There are some clear differences: allergies, itchy, watery eyes, sneezing, as opposed to COVID, fever, chills, muscle body aches, that real flu-like symptoms, and especially that loss of taste or smell, nausea or vomiting, and diarrhea. Knowing the common ones between there: cough, shortness of breath, fatigue, headache, sore throat, congestion. If you need to and you feel like you are not sure if it's allergies, or typically I don't have allergies with trees, then you may be closer to having the COVID symptoms. Next slide. Which brings us to your options for testing. So if you need testing, today at the Hill Country Youth Event Center, we still have the last day for free testing, and that will be open until 5 o'clock. And that is out at the Hill Country Youth Event Center. And then we'll work on having another date in April. The other testing available locally here: Peterson Urgent Care at 1740 Junction Highway is available if you're symptomatic. Peterson Medical Associates on 1331 Bandera Highway, you have to call for an appointment, but they will test you if you're asymptomatic at 896-4200, option 1. And then the Franklin Clinic at 723 Hill Country Drive. You can go on their website there. They have an online calendar, and you can choose your dates and your times if they do have any to pre-register. Next slide. So where are we at with the vaccine? So the vaccine phases had changed since the last time we had a community update about a month ago. We are continuing here in Kerrville to focus on that phase 1B. Remember, as before, we had 14,000 residents that were 65 and older. We had 14,000 residents that were between 16 and 64 with medical conditions. And then added to that phase were the 1,000 school and licensed child care personnel. So we're continue to focus on the phase 1B for that. Since our last meeting, they have added the phase 1C. So they said people between 50 and 64 are eligible to register and get the vaccine. So that has been opened in the pre-registration process for that. And so they are on the list if you're registering for that. Effective March 29th, so phase 2 comes out from the governor, and that is basically the general public. As you can see for Kerrville here in Kerr County, there are 43,000 people that are general public that meet the qualifications of 16 plus for the Pfizer vaccine or 18 plus for the Moderna and the Johnson & Johnson. Next slide. So where are we at here with Kerrville regarding the vaccine? According to the Department of State Health Services website, so a total of 16,000 total doses have been administered. That's 11,000 people that reside in Kerr County with at least one dose and 5,000 that are fully vaccinated. So the total doses by age group is also available on the website. And I thought it was kind of interesting to look at the numbers that between 16 and 49, 3,100 people, remember they are probably ones with those medical conditions. Between 50 and 64, 3,300, 65 to 79, 7,100 people, and 80 plus or 2,400. And just remember earlier, we were saying there were 14,000 people in that category, 65 plus. So we're at 9,500 of those have received at least one dose. Next slide. So the pre-registration process is still available. We encourage, if you encourage the vaccine, if you want to receive a vaccine, you can go online at the website, and it's www.research.net/r/Peterson Health. And that has been published. You can get that on the Peterson website. If you are unable to have internet access and you're unable to have an email access, we can assist you with the registration process at 1-800-208-3611. Other local sites that also encourage to register for that is at Walmart, Walgreens, and HEB. So when they get availability, you can also get on their pre-registration list and they'll give you that notification. And of course, as always, our veterans, so Kerrville VA does provide that through Audie Murphy. So if you are a veteran and have benefits, you can go to the VA website and they can provide information on how to get that. I believe they have a registration and a call number for that. Next slide. So with the addition, since the last time we talked with the Johnson & Johnson, learn about the vaccine, encourage everyone to get vaccine. So we got into this together. We're going to get out of this together. So you can go to the Department of State Health Services website and you can find a lot of information, a lot of really good information on there about where to get vaccinated. They have the list of hubs, all vaccine providers. They have interactive maps. There is important education information. So learn from those reliable sources. They have links to the CDC and the FDA about the Moderna, the Pfizer, and the Johnson & Johnson. Frequently asked questions, so they can definitely kind of get any of the concerns that you may have about the vaccine, about registering. They can answer those for you. And as always, I ask everyone to please be patient and kind. Our priority is protect our community and your loved ones. We are working toward that. So we do see the light at the end of the tunnel, but we're not out of the woods yet. So next slide. And with that, I'll turn it back over to you, Mr. Mayor.
All right, thank you very much, Chief. Chief has done a great job through this whole process of keeping us informed. At this time, Corey Edmondson of the Peterson Health will share with us a perspective.
All right, thank you, Mayor. So good morning. Glad to be with you again. And yeah, Mayor mentioned it's been a year since we've been doing these updates in some form or fashion, a lot of it through this video. But we're in March, and if you can think that on March 11th, to be exact, that's when the World Health Organization declared this a pandemic worldwide. So we've been at it. And I would say that everybody's in March and thinking, hey, March Madness, you know, with basketball, but Peterson is I'm gonna mention some things that we're thinking about it as March Gladness. And it has been a year, but it's been just really surreal. But from a real standpoint, I will tell you that between Peterson Health and the city and the county, the independent school districts, Shriner, all the key stakeholders have been partnering together for a year, every day, trying to help manage this. And wow, what a difference a year makes. And I'm proud of what we've been able to accomplish and what we've achieved together as a group and as a community. And it's been neat to kind of reflect back on and see. And I'd say the community's been a big part of that success. You've heard, you've listened, you've been trying to be educated and informed about what's been going on. We've been in all this together, so just thank you. Next is, where are we right now? What's going on, et cetera. Chief highlighted a few things, so I won't repeat some of those facts. But I will tell you that today we have now 5 patients that are hospitalized with COVID. We have discharged 1, and they are home doing well. But we've had a little bit of an uptick in our overall hospitalizations, but it is significantly down from where it was, and we're thankful for that. There are days where we had 0 patients in the hospital with COVID, and that has given our nurses a respite, has given them a pause to kind of breathe, and I'm thankful for that. A few other things where we are that have just been kind of that March gladness that I'm thankful that we've been all along. We've been very flexible with visitors coming into the hospital to help take care of their loved ones. Family is very important. I found out just about a week or 2 ago, we're one of few hospitals in the state who had the type of visitation availability to our community. There are some hospitals in the area and in the region just in the last couple of weeks started opening up visitations just from Monday through Friday, 8 to 5, or just one visitor to see their loved ones. It was amazing to me that they're just now doing that. We've been doing that pretty much all along. So I've been thankful for that. Also happy that for the past year, we've been testing at our urgent care center, and there's been a little bit of let up in regards to the volume of people wanting to be tested because the symptoms are down and they're seeing that. I will tell you, the month of March, the positivity rate for the month of March of those who we've tested or those who wanted to be tested was just 3%. That goes back to early in this pandemic, the levels that we all were when things started kind of ramping up. So I'm thankful for that. That's the lowest we've been in a year, is a 3% positivity rate. The other part I'm proud about and thankful for, let's talk about the vaccine clinics. We've done multiple first dose and second dose vaccine clinics, mass vaccination clinics, and they've been running very smoothly. In fact, multiple people have been saying how impressed they have with our process. They've expressed their appreciation. They've been very thankful that we've pulled this together with our community, and we've had the assistance with the city to accomplish this. And it's been a great process. I'm also thankful that we've been able to set up that pre-registration site that the chief mentioned in his website. We set that up for people to go on and pre-register. To date, we've had roughly about 10,000, almost 10,000 people register for that at that site. And we've whittled that down. Some people have already been vaccinated that we've contacted to get vaccinated. They say, well, I've already been vaccinated, or they don't want to get vaccinated for whatever reason. We've whittled that down. With our mass vaccination clinics, we're now at about 2,500 today. Of those 2,500, about 600 are 65 and older. Starting Monday, now that opens up to any adult. And so that's going to go right back up from a pre-registration site. But we have had that pre-registration. It's been a great tool for us to do, and we notify people electronically and or phone if they don't have that, when their appointment time is and when they can get vaccinated. We've had a steady stream of vaccines come in. I'm thankful for that. We've been all over this. We've communicated with the powers to be to get us more vaccine, and I think they're starting to hear us. And just last week, we got 1,500 that have been allocated to us. That's the most we've ever received to date. And overall, we've been allocated about 5,500 vaccines, and will have been quickly getting those shots in arms as we receive those. So that's been we've appreciated that. So I'm just proud of the staff that's been working to put up that vaccination clinic, those mass vaccination clinics. I'm telling you, community, they've been working extra hours. They've been working weekends. They've been working to midnight just to get this rolling and the logistics behind that. I'm appreciative of them. It's a lot of effort and a lot of work to do that. And so that's kind of where we are on the vaccination piece. We're feeling positive about the downward trend of what we're seeing today, but that's no reason to let up your guard. But we are appreciative of the respite that we're getting today. I want to take just a minute and go kind of on a personal level outside of the statistics that I just kind of gave you. It's really on a time for support and reflection. You know, this pandemic was not something that any of us necessarily we created. It's something that the entire world had to deal with, whether we liked it or not. But I believe in my heart that everybody's done the best they can with the solutions and the tools that they've had at their disposal. When we're all in this together, I want you to reflect on what we've been through for the last year, what we've communicated, the things that have been set up, the things we've accomplished, and not take any kind of one isolated incident personally that you're having to deal with or that the community is dealing with and take that in a negative way. I want to get back to we're a positive community. So we're all in this together. I will tell you the county has done the best that they can do, that they know how. The mayor has gone above and beyond to reach out and help where possible. The city has been a true partner and supported us with Peterson and all that we've done every step of the way. School districts and the university have been supportive of each other and been a partner in this, and we've been trusted. It's been a worthwhile effort in what we've done for a year now. The community needs to know that the leaders are ready and still able to do those things. We're not going to stop, not a single second, to make sure that our community is taken care of. So we continue to thank you for your support and encouragement in all that we do. That keeps us going. Negativity necessarily does not, but we excuse that and we filter that and put that out of our heads. But we're all about positivity. So let me take this to a personal level. For you personally, let me encourage you that we've all been under stress, both emotionally, physically, financially, spiritually. We've all been dealing with this. Take time to seek help and take care of yourself. Choose to make some positive steps towards that healing. Now's the time. Spring, the sun's out, there's rain, and things are greening up. Be positive. I encourage you to be that way. Don't beat each other up with negativity. None of us need that. We're about Kerrville kindness. There's enough negativity and blame in this world. We don't need to treat each other that way, or you don't need to treat someone else that way. It's been encouraging. We've been fed a lot of encouraging things from the community. Choose to build other people up. I think that would be great. So I'll leave you with Peterson's thankful for the support you've been giving us again. We're here for you. We're thankful that our community feels comfortable and confident in coming straight to us for help. We care about you. We care about our community and anyone else that needs our care, whether it's COVID or anything beyond that. Let me leave you with this positive thought. I heard this in my recent past. Your mind is a powerful thing. When you fill it with positive thoughts and do positive things, your life will start to change. So I'll leave you with that. All right, Mayor.
All right, thank you very much, Corey, for that word from Peterson. I hope you caught the numbers that he is giving about how many vaccines Peterson Health has administered in our community. You put that on top of vaccines administered at the state hospital, patients and staff, VA hospital, patients and staff, nursing homes, 3,400 healthcare workers, the number of senior adults. It is significant, and now for teachers. And so we're thankful for that. Let me say just two things. One, I've had people tell me COVID is not real, that it's not true. I've had others tell me, oh, COVID is overblown. It's no more than a common cold, whatever else. But I want to tell you, I know some young people who have been severely affected by COVID, either respiratory, heart, in one case, neurological. We have 83 deaths in our community because of COVID. And some say, well, maybe they had something else. No, maybe they did have something else that made them more vulnerable. But folks, we're dealing with our friends and neighbors who are in grief and some really hurting. And the Kerrville kindness that Corey Edmondson talked about is really needed in our community. Now, let me say this. Part of the responsibility of the city is to help keep citizens safe. You see that in regard to traffic laws, building codes, regulations related to fire, regulations related to food served to the public. You see it in a whole lot of different ways. Out of this experience, the city is looking at, and with the county, a public health authority that would help us look at and deal with those broad community health issues. And we're setting up a task force to look at it and then come back with a report. But we hope it is one more step to do what a city ought to do and to see folks healthier and functioning well. Thank you very much for participating in this community update. Again, after a year of these, but thank you. Be safe and stay healthy.